Hey everyone, what's up? It's Dr. Charlie. In today's video, wanted to answer a question from a woman. She's 22 years old. She just reached out to me. Basically, she about a year ago started to develop some back pain, some hip pain. Maybe it's piriformis syndrome. Maybe it's not. Up to this point, now she has some leg stuff as well. She's been a PT. She's been a chiropractic. She's actually had a hip injection because they saw some labral possible tear with some cam impingement, basically some bony changes within the hip joint that might have been causing some pinchiness in the hip. She said, hey, it didn't really seem like it presented like it. I guess she's done some research, but she had the injection and guess what? It didn't do anything. Surprise, surprise. And she had a question. She said, so like, are injections and surgeries, like, are they things that like a lot of your people end up having, or are these options to treat these things? And of course, it's an option. So the quick answer is, yeah, I mean, it's an option, but really the honest answer is this. As you can tell, they're already hunting for what the problem could be. So they don't really know if it's a hip problem, hence why they gave an injection to it and they wanted to see and it didn't work. Chiropractor, PT, so chiropractor is probably treating a lot of the spine, maybe the hip, it's not working. PT is maybe treating all kinds of things. Who knows nowadays with PTs treating, and maybe she's had some other things, but she's done a bunch of stuff and it's not working. So the point is that despite some different images and diagnostic injections and all kinds of different eyeballs on this problem, it's not working. So as far as like, yeah, are other injections and or surgeries an option for this? Yes, they are. But the truth is that if you don't know what the problem is medically, then you don't know how to treat it if you're going to use injections or surgery. You're going to use motion, you don't need to know so much. Okay, you don't need to know at all, really. As long as it's not cancer, fracture, infection, something that's life-threatening, you don't need to know the diagnosis, the medical diagnosis to treat it. You just need to know the movement diagnosis. But again, let's stay on track here. What are my thoughts about injections and surgeries for these back, butt, hip, leg pains, piriformis syndrome, hip problems, in this case, what they thought was a hip problem, but maybe isn't. What do we do about it? So again, there's a difference between a medical and a movement diagnosis. If you're going to do an injection or surgery, you need to be really sure as to what the heck the problem is. And the issue is that MRIs, x-rays, things like that, they can't really pinpoint things very well. They just show all kinds of things. In fact, I don't know the exact stats, so I won't quote them. But we found there's a high prevalence of these labral tears, hip problems, whatever in everyday people and athletes. And actually, I think there was a higher prevalence. I'll have to link this study below. There was a higher prevalence of hip labral tears in medical students. She's not a medical student, but than there were in like ballet dancers and some other athletes. So pretty crazy. So in everyday people were just sitting on their butt, right? And then athletes were out there kind of challenging their body, right? They have all these tears and all these problems, and MRI can't differentiate. There's nothing on their MRI that says, woohoo, like over here, like I'm a problem and I'm relevant. I'm the reason for the pain, right? So if you're going to do an injection, you're going to do surgery, you better darn be sure that you know what the heck it is. So number one is people think that we can find the answer to most of these musculoskeletal problems with the muscles, the joints, the nerves, and find the origin. Most times you can't. There are some special cases where it's very clear. You just bent over, you're all crooked, you can't straighten your leg. Yeah, it's a disc problem, okay? In 95% of cases with pretty good accuracy. But for the most part, a lot of these things just begin gradually and you can't really pin it down. It's super frustrating for people. So that's that. And the other thing is that she's 22, and not just because she's 22 is it maybe not a great idea to have more injections, but for anybody, injections contain some type of steroid and a numbing agent. So you don't want to put too much steroid in the body and just start shooting it everywhere, because that can actually damage tissue. We know some areas of the body, like the elbows, I think shoulders too, we see worse outcomes long-term if we give people injections. It feels so good in the moment if it's actually going to work, but then it actually causes some type of damage or some type of interruption to the healing long term. Okay, now the other thing is that people think that, okay, if I go to PT and if I go to chiro and I do massage and I try all these things, I tried everything, Charlie, then if they go to injections or they go to surgery, that again, that's like an escalation of the problem. It's like the next thing. If not this, if this doesn't work, then I'll try the injection. If that doesn't work, then I'll try the surgery. Well, what do you do if those don't work? Well, good question. Okay. But the point is that it doesn't work like that at all. They are not a last resort. There's nothing resortful about them at all. You don't like get delivered cold drinks and like lay on a beach or anything like that. Instead, what we know is that the outcomes from especially a lot of these hip surgeries, injections, are like no better than the things which you're trying right now, which are maybe movement, or she's going to PT, chiro, things like that. All right. So just to give you a little visual here, people think that, let's just say this is PT, and maybe, I don't know, maybe for this problem, chiro would be maybe a little bit better or whatever. And massage is somewhere in there, right? Don't know why it's not drawing. Boom. That's annoying. Third time's a charm. Come on, hang in there, folks. Ah! Here we go. Okay, massage, right? And then injections. It's like, oh, that'll be better, and that'll have a better chance of helping me, right? And then surgery. That's gold. That's like ding, ding, ding. Like, I have something I can go to if these things don't work. And that's what I need. But it's not. They're all on the same playing field. So you stop tricking yourself into thinking that there is a better solution. I'm telling you, there is not. They are all equal in outcomes from the majority of problems. And here's the thing. These things, the injections, the surgeries, right? Things like that, they have much higher risk. So the benefit, the ability to help you is comparable, let's just say, across all parameters, right? As far as function, pain, this and that, in the majority cases. Look, I'm not saying there aren't some cases, severe signs of nerve damage, wetting your pants, loss of function, nerve death, right? Those types of issues, cancers, fractures, things like that. You might need these things, okay? But at the end of the day, just realize that pill surgery, injections, these things that she was asking about, they are proven to be essentially no better. In fact, in the world, in the US for sure, we have like the highest incidence of opiate use, so pain pill use, and we have the highest level of chronic pain. So what does that tell you? The stuff don't work. It don't work very well. I'm not saying it doesn't work for anybody. I'm just saying if we look at the big picture, it's not an effective solution if we step back. Okay, so realize that injections and surgery for most of these problems are no more effective than what you're doing right now. Okay, and what you're doing right now is probably relying on someone else to fix the problem. So you're going to someone to have them do something to you, when in actuality, right, at the end of the day, consider that you need to move yourself. Oh, very nice. That's my daughter. Okay. So what I mean by that is you've got pill, shot, surgery, motion. If you're going to someone and they are moving you, then how much data are you collecting? How much are you learning on your own? When you leave that place, right? What are you taking away from it? Do you know how to better treat yourself and fix your own problem? Probably not. By the way, I used to do that. I used to be very hands-on with people, okay? But what if you could learn to move yourself? Okay, so realize at the end of the day, the medical community is not going to bail you out of this. Going to someone to have you fix it might work, but again, there's dependency upon that person. You need to look inside. You need to be accountable and say, okay, this is my problem. I have to fix this out. Passing the buck and hoping for injections or surgery, while I understand that you want to do it because you're in pain, will yield no greater result. In fact, it has much higher risks and it doesn't teach you anything. So just because you have an injection and it helps you, what did you learn about that? How have you changed your pattern of the things that you're doing, the things that you understand about motion and how your body works? How are you changing all of those things, all those lifestyle, environmental factors? And then what are you learning about movement, which is the most natural type of medicine? So in the presence of not much better across the board, don't consider these things as a last resort. Yes, they are options. They are part of the picture. They are necessary in some cases, but don't think that you can just, again, pass the buck. And again, if you do these things, there are risks involved. So just understand that, okay, that was sort of my answer to her. And, the trouble is that these problems, as much as people don't want to believe it, you can almost never find the exact source of pain. Instead, what you're going to get is you're going to get a false sense of a diagnosis, because you're going to travel all over the freaking place and you're going to have 10 different people tell you opinions of what it is. So you're going to walk out of there with a card that says, okay, I feel so much better. I think we're getting closer to a diagnosis and we can treat this thing. The diagnosis is almost impossible to find. It's a false sense of reality. You can't figure it out in the majority of cases. So you're going to have to take that away as a barrier. Instead of focusing on what this problem is, assuming it's nothing life-threatening, right? It's not a clear case, right? You've got to start focusing on what you can do to solve the problem. So boom, power to you. If you need help, by the way, this is all I do is I help people kind of work through this mess as it relates to back, butt, hip problems, either just happened or a lot of chronic cases. So wherever you are, if you need help and you'd like to potentially chat with me to see if I can help you out, just go ahead, click the link below. Also, if you found this video valuable, kind of shifted your mindset about things, even though it was a little bit to the point. Sorry, I was a little rough there. Just go ahead, hit the like button, also subscribe, and shoot any comments below with other videos and or other things you want to learn. Okay. Thanks so much, everyone. Chat soon.